Again, thank you for being with us. You are watching special coverage from Channel 9 of coronavirus questions answered.
And we have been collecting your questions through calls, emails, social media, and on the streets around the Charlotte area. And tonight, we have a group of experts gathered live here in our studio to answer those questions. So want to get right back into it with a 2-for-1 question. One viewer, Leslie Hardy, wants to know how long the virus can live on surfaces. And on a similar note, Jackson Adams is asking, can it be transmitted through money that people are passing around? So we have two physicians here, Dr. Sullivan and Dr. Passaretti, and we'll pose both of those questions to you about the money and how long it can live on surfaces.
So, you know, it's still being debated how long this particular virus can live on surfaces. Some studies have shown a couple of hours, some have shown a couple of days. I think the thing to come back to is that if you wash your hands regularly, that's no matter what surface you're touching, assume it's contaminated, and by washing your hands, you can prevent any spread of infection.
And there's a correct way to wash your hands.
There is a correct way. Yes, a correct length, a correct way.
Yeah, no, and I think again, you know, and this is a core public health and medical message that we say over and over again. Hand washing is incredibly important. And you know, some of the other key public health messages that we always say is what we just need to remember here.
Is it 20 seconds with soap?
Soap and water, and the trick is, singing happy birthday twice is usually what,
Got it.
yes.
Got it. And so that money question, that's the same as with
the same thing.
issue.
I mean, again, I think we don't know, and you know, viruses survive differently depending on what type of material it is, and we're still learning more, but I think the idea is hand hygiene is really the best way to go.
All right, thank you. Now, our next question is coming in from Facebook. This is from Lupita Monroy Garcia. She says that, I'm pregnant. What's the risk of having the baby born okay? Or any other complication that we should know about? So she's concerned for her unborn child. Any relation between coronavirus getting it and risk to the baby?
This is another one we're still learning about. You know, there's very limited data on how this infection affects pregnant women. It does not seem like the virus is spread from mother to child during pregnancy. Whether there's an impact on the baby being born a little bit early, I think is still to be determined as we get more information.
But one of the things that we do know is in pregnancy that can affect your immune system and make you a little bit more susceptible to viruses in general. And so anyone who is pregnant should always be taking extra precautions around, again, some of the same things and prevention measures we talked about, because we just don't want them getting sick.
Absolutely.
All right, next question. Tammy Lawson wants to know if we should worry about it being spread through a daycare. And I think the obvious concern would be, yes, it can be spread just about anywhere. But I want to work in Kenny and Mr. Mattier, because that is the kind of concern that shuts down the businesses. That's when people might say, I'm not taking my child to daycare possibly. Or we talked about the restaurants. People are very concerned about any gathering of children, of adults. Have you talked to any businesses who are like, we're suffering because of these types of questions and concerns? Kenny, take it first.
Okay. Not at this point in time, but I did hear, I talked earlier about it, that there was a gentleman that had 2 children. One was 5 years old and one was 4 years old. The 5-year-old the school was just closing the school down. They were going to be at home. But the daycare for the 4 years old was still going to be open. Now the dilemma that they had is, if I'm going to be home with the 5-year-old, I might as well keep the 4-year-old home. But if I do that, I'm still getting charged from the daycare. So it's a double whammy. I'm getting charged for daycare, and I still have to be home with the children. And then what happens is that once the parent sees one parent taking their child out, that's when the fear and the panic sets in, and then they're going to take their child out. And so before you know it, back to what we were saying about small businesses really depend on the community and the environment to keep them in business. Right. So yes, this plays a vital part in the survival of small businesses. That's why we need to really understand what we're up against. We have good information, and that people really just this panic. You've got to calm down. We can't get this panic and fear get into us, because it causes a ripple effect, and it could be to no end.
We've not really seen it affect businesses yet, because the daycare closing is something that's brand new. But if this continues, it's certainly going to affect the business community, because that means the employee has to decide, do I stay home with my kid? Do I go to work today, et cetera? And 9 times out of 10, they're going to take the child over work every time. So that means it's going to be attendance problems at work, et cetera. Or the family's going to have increased costs to find alternative, more expensive last-minute daycare. And that's going to be a big financial burden on these families. So this is an issue that hasn't really happened yet. But if we continue at this pace, we're going to see that next week and the following week.
Right. And that's really going to affect, like I talked, the vulnerable community and the at-risk or the low-wage incomers, the service providers, that, it's really going to have an effect on them as we move forward.
Yeah, those who can least bear it
Yes.
will be suffering the
Yes.
most. We do have another question coming in. This is from Emily Schaefer on Facebook asking about being quarantined. Does that mean the whole household or the specific individual? So if you find someone in your household who has been in contact with someone or who is found to test positive for coronavirus, does that mean just that individual, hey, you go stay in the basement? Or does that mean then the whole family should, take it upon themselves to say, okay, we're all going to go through this together? Dr. Sullivan, Dr. Passaretti, what would you say?
Yeah, I mean, it's a good question. And I think one of the things I first want to clarify is the difference between isolation and quarantine, because I think sometimes those terms are used interchangeably. So isolation occurs when somebody is sick. So either they are very strongly suspected, and if we're talking specifically about COVID-19, strongly suspected of having COVID-19 or have been diagnosed with COVID-19. And they are capable of spreading the disease to others, and they need to be isolated and away from others so that they can't do it. And that isolation, if they're sick enough to be in the hospital, would be done in the hospital setting using appropriate precautions. And if they're not sick enough to need to be in the hospital, will be done at home, but that would want to be done in as much isolation as possible. Quarantine is for people who may have been exposed to the disease but are not sick and therefore are not spreading the disease to others. And so that is done kind of in the home setting, but it's really, you're trying to minimize your contact with others in case you do develop symptoms. And the moment you develop symptoms, then you are going to seek medical care in an appropriate way and get tested. But I think to clarify the difference between those is important.
And it really is on the individual person, not necessarily the whole family or the whole household. That's, you're quarantining or putting in isolation.
Did you want to add something?
Yeah, I think it's a matter of exposure. The level of exposure, the level of sickness, and the whole level of exposure. And if you're in a house, just like the common cold, if you're in a house and somebody's got it, the chances are that the whole house is going to get it. So again, the precautions, the hand washing, the making sure that you limit the exposure and do the best you can.
So, yeah, Kenny, go ahead.
I want to take this over to Katie because we had an earlier conversation today about this. So suppose in the workplace you have someone who has been infected. Obviously, you're going to remove that person from the workplace, but how many of the surrounding employees do you also take out? Is it the whole company? Is it the department? Or just the people within 3 cubes away? So I'm going to turn this over to you, let you talk about it, because we had a great conversation about it this morning.
We did. Yeah, so it really is close contacts that are most at risk, so those household contacts you were talking about. The virus spreads best within a 3 to 6 foot range, so people that are in that range for a prolonged period of time, those up close and personal with coughing and sneezing, secretions, those are the ones most at risk. So it doesn't mean if someone has it in your business that the entire business has to kind of shut down.
And I will just add that, if somebody is diagnosed, that is a huge role of the health department and our communicable disease experts. That's what we do, and we do contact tracing and contact investigation and use kind of evidence-based guidelines to determine who does and who is not at risk of exposure and what needs to happen.
So you will inform them what they need.
Exactly.
You talk about diagnosis, Dr. Sullivan. That leads into Cedric Barnes' question. He's from Charlotte. Let's listen.
I just want to know, what are the symptoms, of the coronavirus, because it seems like it's kind of like the flu-like.
So is it the flu? Is it allergies? We know pollen is out there right now. Is it a common cold? How easily can the average person kind of diagnose what they are dealing with?
Yeah, I mean, I think it is a really great question, and you're exactly right. The most common symptoms that we're seeing are fever, cough, shortness of breath, and those are the symptoms that we do see in the flu. As you mentioned, it is allergy season, and we know that people are going to be coughing from the pollen. And so really, if someone does develop those symptoms, I think it's important to kind of evaluate the entire situation, to think about what else is going on, what were potential exposures, what is their travel history, and if they have questions, to really talk to their healthcare provider, but to understand that a cough or a sneeze does not automatically mean COVID-19.
Well, I've wondered, would you, if you had coronavirus, would you feel terrible? We've heard about people with dry coughs, severe pain, not being able to sleep, they hurt so much, or could it be more subtle than that?
Yeah, so I think different people present in different ways with any type of infection. This virus we're learning about kind of as we go, but there's some suggestion that you have milder symptoms in the first week. You might just feel a little run down, have cough, fever, and then a potential to get a little bit more sick in the second week, as opposed to flu where you feel like you're hit by a truck, you're just completely fatigued, high fevers right from the start. So there's some slight differences, but it is very difficult to tell one respiratory virus from another.
I just wanted to add in from an economic point of view that because of the timing, because of allergies, because of the common cold, because of the flu, this all ties in and it's all familiar symptoms. So that's why we're urging people not to just jump up the symptom and run to the doctor or run to the emergency room because you don't know. So like they said, it's better to contact your health provider.
Call your healthcare provider if you have questions, use those virtual visits. But we are getting a lot of people that have very mild symptoms or very minimal symptoms coming into healthcare, and again, it's kind of clogging up our healthcare system. So making sure you really only use those avenues of care if you need them.
So call ahead, like we said, use those testing centers first before you just walk in. We're going to take a quick break, and then when we come back, we're going to talk more, continue our conversation about coronavirus, your questions answered, looking at things like flattening the curve, social distancing. We'll be right back.